So thank you very much for the opportunity to speak today. I'm actually going to be talking about a research study that we're just getting started with in Melbourne. So I am a respiratory and sleep physician or clinician, and I also work in research. And the study that I'm going to tell you about today is a study entitled Early Sleep Interventions to Improve Outcomes in Children with Neurodisability. And this is a multi-site study, so the work has already gotten underway in Queensland, and I'm working together with colleagues in Sydney also. So just to get started, in terms of neurodisability, just to think about the definition for this group. So neurodisability encompasses behavioural and cognitive disorders that arise during the developmental period and involve significant difficulties in the acquisition and execution of specific intellectual, motor, language and social functions. An alternative definition from DSM-5 is that the onset occurs during the critical developmental period, including deficits that produce impairments of function. And approximately 500,000 children in Australia have neurodisability, so this is a very large group of children. In terms of which conditions fall under the neurodisability banner, firstly, genetic syndromes are one of the groups, and you can see that Prader-Willi there is the first diagnosis mentioned amongst others. Children with neurodisability may also have other neurological conditions that are acquired, such as cerebral palsy, or a congenital defect such as spina bifida. It includes children with neurometabolic disorders and also developmental disorders that you can see there, and that is one of the largest groups of children with neurodisability. So coming back to sleep then, why research sleep? And I'll start by talking about the 2019 parliamentary inquiry into sleep health, and I think this gave sleep medicine a bit of a step up, or some media coverage at the time. And as a result of this inquiry, the Australian government recommended that sleep should be a national priority. Sleep is now considered to be the third pillar of health alongside fitness and nutrition, which is where it should be. And from looking at Australian data, sleep problems across the first 7 years of childhood actually cost the government nearly $30 million a year, apparently. So sleep problems are very prevalent in children with neurodisability. We know that over 80% of children experience severe sleep problems, as opposed to about 30% of their healthy peers. So they make up approximately a third of children that we see in paediatric sleep clinics, which is why we should be interested in this group. And these problems emerge early. So problems with sleep start early, they often persist during childhood, and they certainly impact on day-to-day function. And these sleep issues compound existing learning and behavioural issues. So for anybody in the audience that has a child, you will know that sleep is very important, not only for your child, but also for the parents and the family. And we know that sleep issues can profoundly impact quality of life for the entire family. So in terms of the types of sleep problems that are found in children with neurodisability, these really do reflect the same issues that are found in otherwise healthy children, but as mentioned previously, occur at a higher rate. So sleep-disordered breathing can be common, and this may be due to phenotypic features in the child, due to issues with tone, with muscle tone, due to chest wall abnormalities. Can possibly be in the setting of disordered central control of breathing, obesity, as we've just heard about, and in the setting of certain medication. Sleep problems can include difficulties with falling asleep or sleep onset, with maintaining sleep, which can be seen as frequent night wakings, and also circadian rhythm abnormalities. And children with Prader-Willi syndrome also have a high rate of sleep problems. So in terms of sleep disordered breathing, we know that about 50% of children with Prader-Willi can have obstructive sleep apnea in various studies. In terms of central sleep apnea, around about the same prevalence, and children with Prader-Willi also experience issues at times with excessive daytime sleepiness, which we believe are in the setting of not only potentially poor sleep quality, but also circadian rhythm abnormalities. So in terms of the study that we have been funded for by the MRFF, this is a 3 to 5 year multi-centre study to enable early effective sleep interventions to improve functional outcomes and quality of life in children with neurodisability, and that's inclusive obviously of children with Prader-Willi. I did mention the 3 sites, and the colleagues in Queensland and Sydney are the other CIs, Dr. Chawla and Dr. Karen Waters. So the overall aim or objective of our study is to improve quality of life and functional outcomes in children with neurodisability by modifying their sleep. And the end goal is to develop a national guideline for diagnosis and management of sleep problems in this group of children. So in terms of more specifically, the aims of the research are to improve understanding of sleep problems in this group, to develop novel tools to improve the diagnosis of sleep problems in children with neurodisability, and then finally to provide an effective intervention for non-respiratory or behavioural sleep problems. So I'm just going to talk through the 3 arms of this study. So firstly, phase 1. So the first part of the study is designed to improve the understanding of parental perceptions and current community management strategies for sleep problems in children with neurodisability. So the research questions are, firstly, how common are sleep problems with neurodisability, to get some better Australian data. Here we will be comparing children in the community with neurodisability to those coming to sleep clinics in the 3 participating centres. Secondly, what are the sleep health priorities for families of children with neurodisability? And we do have a consumer working group inclusive of one of our parents, actually from Victoria, is a parent of a child with Prader-Willi. So it's really important to us to include this consumer perspective. And thirdly, what are the current management strategies used to treat sleep problems in children with neurodisability? So who is treated, how are they treated, who manages this, and when are they referred? In terms of the study design, so this part of the study is a cross-sectional survey. So there's an online link, and the data provided is then entered automatically into a secure database, and that's the link there. And Prader-Willi Victoria has been very supportive of this project, as have other organisations, and will be helping to distribute this survey to relevant families. So this survey will be distributed to participants via community representative organisations, clinics within the hospital, and a separate cohort recruited from sleep clinics specifically. So we want to include caregivers of children with a clinician diagnosis of neurodisability from birth to 18 years. And our aim is to survey a minimum of 500 participants, and including 100 from sleep clinic. And I think at the minute we're at about 150 responses. So the survey content, just briefly, there's a consent form, opt-in for further research, opt-in for significant results to be sent either to the participant or to their caring physician. We'll be collecting some demographic and medical history. And then in terms of the actual survey, these questions, as mentioned, will be about sleep health priorities, and will include questions about sleep duration, continuity, sleep timing, the impact that any sleep issue has on the child's health, their family's health, their daytime function. There'll also be, there's also questions from 2 validated sleep questionnaires and some specific questions about sleep management that they've already received, including medication. So I might move on. However, this slide is just really encouraging people to participate or share the survey widely, and I can forward this information following today to anybody interested. So the second phase of the study then is to evaluate a novel tool for sleep diagnostics in children with neurodisability. So for those who have some knowledge about clinical sleep medicine, we use polysomnography or sleep studies as really the gold standard key investigation for diagnosis and quantification of sleep disordered breathing. And this particular test largely relies on a particular index of respiratory events to diagnose and quantify sleep disordered breathing. However, what we know is that in children, often there's partial obstruction rather than discrete events. So rather than I guess the important point here really is that rather than just a number, there can be there's other qualitative data from the sleep study that can be really important in guiding management for children. So this is a test that can be hard to do well. So it's a labour-intensive test. It needs skilled staff to ensure accurate and optimal monitoring so that the results can be interpreted properly. And it also requires a specialised lab environment, and this can be an issue for access, particularly for children who don't live in the metro areas. For children, undergoing a sleep study can also be challenging, so it involves intense monitoring and sometimes can be a struggle for the child to tolerate leads. It's a different environment to home, obviously, and it would be reasonable criticism to say that the sleep in a sleep lab may not reflect the usual sleep at home. It's also relevant to point out that sleep studies can be a greater challenge for children with additional needs, for those with neurodisability, for those with sensory issues. It can be a more confronting test and environment. What I've included here is just some feedback from various parents of children, or perhaps from sleep staff, just really documenting, issues from sleep studies. The child. We read this all the time when we're reporting studies. The child was distressed during the setup. We didn't get the leads on. The sleep staff have to repeatedly go back in and apply leads. Have you had a sleep study, or your child's had a study? Yeah. But I mean, as you know, we do persist, and we usually do get quality data, but it's a very resource-intensive exercise, both for the families and for the staff. Without going into the specific detail, this is just an example of a study where we haven't got good good measurement data. This is really just a snippet from the view of a parent who has a child with Down syndrome who is a nurse, and we thought this was relevant to share this perspective. So this parent says that as a nurse myself, maybe I'm not the usual mother, but the setup wasn't, so this is obviously talking about a sleep study, the setup wasn't too bad, easy in fact, as the nurses go very quickly. The hardest part was at the nasal prongs and the thermistor, which is a little bit that sits in the nose or just above the top lip. But we waited until she was asleep. Getting her to sleep with all the gear on was another story. Somehow, though, we do manage to do this. Really, to summarise then, we do need alternatives, and ideally we need a test that is less invasive, that is better tolerated, that it's easier to use for staff and for families, and possible to do at home, so that it's less burden on hospital resources. And this became really clear to us during the COVID pandemic. Not that it's over, but it became a lot more tricky to have children admitted to the hospital. Families were more reluctant to come to a hospital environment. So all of the issues that we usually experience were exacerbated. We also need an alternative that's more reflective of paediatric sleep disordered breathing, so accurate measures that can predict treatment outcomes, and an alternative that's affordable and accessible. So that brings me to this particular device, the Sonomat, which is a diagnostic tool that was invented by Professor Colin Sullivan, who some of you may know, invented CPAP. I'm going to get a move on as well. So essentially this is a mat. So it's a mat that's placed under a sheet, and it makes many recordings for similar to as is found in a sleep study without going into the detail. And there have been the published data, paediatric validation studies. These are some of the older studies looking at comparisons between Sonomat outcomes and sleep study outcomes. And what these studies have shown is that the Sonomat scoring system accurately diagnoses sleep disordered breathing in children with the current metrics. It permits quantification of partial airway obstruction, and runs of snoring and stertor, which is sort of noisy breathing, do actually happen more often than discrete events, as sleep clinicians know, and are associated with more sleep disruption. So this becomes a very interesting tool to think about. So the results to date are promising. The Sonomat appears to be safe at home, and there's published data in the Down syndrome group. However, we'd like to extend this to other disability groups. So I'll move on. So the second phase of the study really is to evaluate the Sonomat sleep mat for diagnosis of sleep disordered breathing in children with neurodisability. And as mentioned, so we'd like to extend the studies to children with diagnoses outside of Down syndrome. And really the key questions are, how does the Sonomat compare to sleep study diagnosis of sleep disordered breathing? And can the Sonomat be used as a home sleep diagnostic tool? So this part of the study involves, again, children between 2 and 18 years. We're going to ask, we'll be recruiting from the 3 centres, and we're going to ask those children to have a sleep study, their regular sleep study with the Sonomat under the sheet, and then 3 nights of Sonomat monitoring at home. And we'd like to recruit 150 patients. So I might move on then to the final part of the research study. I'll be brief here, and this is probably, the purpose of phase 3 is to improve diagnosis and management of behavioural sleep problems in children with neurodisability. Just some background, behavioural sleep interventions are commonly used as first-line therapy for management of non-respiratory sleep problems, but programs specific to children with neurodisability are lacking. The strategies used in typically developing children are generally effective, but children with neurodisability often have more complex sleep problems that require multiple interventions for different aspects of sleep. And the contribution of comorbid conditions and medications to poor sleep need to be considered in this group. So this part of the study, the research questions are can an e-advice program that we're developing aid diagnosis of sleep disorders in children with neurodisability? How effective is a structured behavioural sleep intervention program for children with neurodisability compared to standard management? And what is the best delivery method for a structured behavioural intervention program for children with neurodisability? So to answer this, we'll be conducting a randomised controlled trial of the e-advice tool versus a telehealth delivered behavioural sleep intervention program versus standard care, which is essentially attending a sleep physician in clinic, which is slide. That's the end. Thanks very much for your talk.